There's an old piece of advice almost everyone has heard: step on a rusty nail, go get a tetanus shot. But the rust was never really the point. Tetanus is a genuinely fascinating disease once you understand what's actually happening. It's not caused by a virus, it doesn't spread from person to person, and the way it attacks the body is almost the exact opposite of a much more famous toxin from the same bacterial family. It's ancient enough to have been documented by Hippocrates, and modern enough that the vaccine protecting most of us from it is barely a century old. Let's go through it properly, from what it actually is to the history behind discovering it to why one vaccine made it almost entirely preventable. Tetanus is caused by a bacterium called Clostridium tetani, a rod shaped organism commonly found in soil, dust, and animal waste, nearly everywhere on Earth. Unlike most infectious diseases, tetanus doesn't spread from person to person at all. You can only get it when bacterial spores enter your body directly through a wound. The name itself comes from the Greek word "tynine," meaning to stretch, a fairly accurate description of what the disease does to the human body. Because it's a toxin driven disease rather than a spreading infection in the traditional sense, a single case of tetanus tells you nothing about whether anyone nearby is at risk. Every case starts fresh from a wound and a source of bacteria in the environment, not from another sick person. The history of understanding tetanus moved surprisingly fast once scientists started looking closely. Clinical descriptions go back as far as the 5th century BCE, but it wasn't until 1884 that German physician Arthur Nicolaier linked the disease to contaminated soil, while Italian researchers Carl and Rattone showed it could be transmitted through infected tissue. In 1889, Japanese bacteriologist Kitasato Shibasaburo, working in Robert Koch's laboratory, finally isolated the pure bacterium and discovered a critical detail: it only grows in environments without oxygen. Just 1 year later, in 1890, Kitasato and Emil von Behring made another breakthrough, discovering that the blood of immunized animals contained a neutralizing antitoxin, a finding so significant it helped lay the foundation for the entire concept of immunization against bacterial toxins. That single discovery, that blood serum from an immunized animal could neutralize a toxin in another animal entirely, became the model for antitoxin treatments used against multiple diseases in the decades that followed, well beyond tetanus alone. Now, here's where the rusty nail myth actually falls apart. Rust itself has nothing to do with causing tetanus. What matters is the shape of the wound, not the object that made it. A deep, narrow puncture wound creates exactly the low oxygen pocket the bacterium needs to thrive, which is why rusty nails have a reputation. They're often found outdoors, in dirt, and they tend to cause exactly this kind of deep puncture injury. But a splinter, an animal bite, a dirty scrape, or even unsanitary umbilical cord care in newborns can create the same conditions. Symptoms typically show up somewhere between 3 and 21 days after infection, depending on how deep the wound is and how far the bacteria have to travel. And generally speaking, the shorter that incubation window, the more severe the resulting illness tends to be, since it suggests the toxin had a shorter distance to reach the nervous system. Once the bacterium is established in a wound, it releases a toxin called tetanospasmin, which travels backward along nerve fibers until it reaches the spinal cord. There, it does something remarkably specific. It blocks the release of the neurotransmitters GABA and glycine, the chemical signals your nervous system normally uses to tell muscles to relax. Without that off switch, muscles receive a constant, uncontested signal to contract, and they simply can't stop. Here's the strange twist: tetanus's closest bacterial relative causes botulism, a disease with the nearly opposite problem. Instead of jamming muscles on, it jams them off, causing paralysis instead of rigid spasm. Same bacterial family, same nerve toxin strategy, completely opposite result on the body. One locks muscles rigid, the other goes limp. Researchers sometimes describe tetanus toxin and botulinum toxin as mirror images of each other for exactly this reason, even though they're produced by closely related organisms using a surprisingly similar molecular delivery method. That constant, uncontrolled muscle contraction is what produces tetanus's most recognizable symptoms. Lockjaw, medically called trismus, is often the very first sign, followed by a tight, forced facial expression doctors call risus sardonicus, the sardonic grin. In severe cases, the back can arch violently backward in a spasm called opisthotonus, sometimes powerful enough to fracture bones or tear muscle. Spasms can be triggered by something as minor as a loud noise, a bright light, or an unexpected touch. And the body's automatic systems, heart rate, blood pressure, can swing wildly and unpredictably. Perhaps the cruelest detail is that a person's mind typically stays completely clear and aware throughout the entire ordeal. Unlike many severe neurological illnesses, tetanus generally doesn't affect cognition or consciousness at all, meaning patients experience the full course of the disease with total awareness of what's happening to their own body. Treating tetanus today involves several coordinated steps: thoroughly cleaning the original wound, administering human tetanus immune globulin to neutralize any toxin that hasn't yet bound to nerve tissue, sedatives and muscle relaxants to control the spasms, and in severe cases, weeks on a ventilator to support breathing while the body slowly clears the toxin's effects. Recovery, even with excellent modern intensive care, can take months, and despite all of this treatment, tetanus can still be fatal in its most severe forms, which makes what happened next in this disease's history even more remarkable. Doctors also typically keep patients in dim, quiet rooms whenever possible during treatment, specifically because light, sound, and touch can all trigger fresh spasms, a small environmental detail that makes a genuine difference in how much a patient suffers during recovery. In the early 1920s, French scientist Gaston Ramon developed a method for deactivating toxins using formaldehyde, originally applied to diphtheria. In 1924, his colleague Pierre Descombes adapted the same technique to tetanus, creating the first tetanus toxoid, a version of the toxin altered just enough to train the immune system without causing disease. It was used widely to protect soldiers in World War II, and by the late 1940s, it had become a routine part of childhood immunization schedules worldwide, typically bundled together with vaccines for diphtheria and pertussis. One important detail people often forget: tetanus immunity fades over time, which is why booster shots are recommended roughly every 10 years and sometimes sooner after a particularly dirty or deep wound. It's a detail plenty of adults forget entirely once childhood vaccinations are behind them, which is part of why emergency rooms still routinely ask about tetanus vaccination history whenever someone comes in with a wound. It's often the deciding factor in whether a booster gets given on the spot. Despite the vaccine's success, tetanus hasn't been eliminated globally. The bacterium lives in soil everywhere, so as long as unvaccinated people exist, the risk remains. The starkest example is maternal and neonatal tetanus, which can occur when unsanitary conditions are used to cut a newborn's umbilical cord. Without treatment, the case fatality rate among affected newborns runs as high as 80 to 100%. In 1989, the World Health Organization launched an initiative specifically targeting the elimination of maternal and neonatal tetanus, focused on vaccinating women of reproductive age, promoting clean birth practices, and improving disease surveillance. Vaccine coverage among at risk women rose from 62% in 2000 to 72% less than 2 decades later, and many countries have now officially reached elimination status, though a handful of countries still haven't gotten there yet, largely tied to broader challenges around healthcare access rather than any weakness in the vaccine itself. It's a genuinely instructive case study in public health. The science has been settled for a century, and the remaining gap is almost entirely about reaching people, not about developing better medicine.